Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Cokerhook. Today, we're going to have what I consider to be a very fascinating, interesting conversation. The gentleman that you can see on the screen with me right now is Dr. Sunil Pai. He's a medical doctor. He is a board-certified holistic integrative medicine physician. And Dr. Pai is the founder of the San Giovanni Integrative Medicine Health and Lifestyle Center in Albuquerque. That's a mouthful, and I finally got it out. But he's also the vice chairman of the Neuro-Acupuncture Institute in Santa Fe, New Mexico. And we're going to be talking a lot about what he does and what the Neuro-Acupuncture Institute does. Dr. Pai, thank you so much for joining us here on Reference Point.
Thank you for having me.
So I really want to focus in on the conversation about neuroacupuncture. It was a new thing for me that I sort of came across because of some studies that my wife was doing. And, so I went and I looked up acupuncture in the dictionary to get a definition.
Sure.
And, it's sort of a compound word from a couple of Latin words, acu meaning needle and puncture meaning to prick or penetrate. And so the natural Western perspective on something like acupuncture is, oh my goodness, if I go to this place, some guy's going to stick needles in me. And our experience with needles are like taking injections or getting sutured or sticking yourself when you're trying to sew something. And it's sort of a negative thing. So maybe you could talk a little bit about what really is this acupuncture and what is the physical experience that somebody has when they are experiencing this technology.
Sure. So let me just start off with a little bit of history of acupuncture. So, acupuncture goes back thousands of years. Formally, when it was kind of written, it goes back to 100 BCE. It was called the Yellow Emperor's Classic of Internal Medicine. There's different like books that they were written in Chinese medicine. Same thing with Ayurvedic medicine, Chinese medicine from India. And what we look at is that was when it was first described, kind of in a written form. But even it goes back even further. And what acupuncture is using is needles, and we'll talk about the needles in a second. But it's actually looking at a system of moving qi. Qi is the body's energy through what they call meridians, which are channels. There's about 12 different meridian channels in the body. They're like mapped. And so if you ever go to a acupuncturist or Chinese medical office or someone who does acupuncture, for example, you'll see these kind of maps, these body maps with these little lines kind of going up and down on their, from the head all the way down to the toes. And these are actually channels in which the energy is being moved. And using the stimulation of a needle, and there's different techniques, different styles, and different even types of needles. It's a way of moving that energy. Sometimes that energy level, the qi is stagnant, and it needs to be like stimulated to have more excitation. And sometimes it's overexcited, and we need to kind of dampen down and slow it down. So that's just in general where it's coming from. Neuroacupuncture is more of a contemporary adaptation of the classic acupuncture technique, using more Western neurological anatomy and diagnoses of neurological diseases, and using the neuroanatomy as a template of where those acupuncture needles will go.
So when you talk about the physiology side of things, you mentioned the meridians, et cetera. When you look at this traditional acupuncture description and the posters and things like that, and I know from the little biology that I did when I was in high school and college that, the nerves have these pathways, and it's almost like a power grid distribution of electrical energy that we have here in the US to get stuff from wherever power is generated to wherever we're going to use it in our homes. Is that a reasonable analogy for what we're talking about?
Yes, in a way. But what's actually happening is where those acupuncture needle points are going are not actually in an artery, vein, or a nerve. So remember, in Western medicine, we have these channels, right? Blood is going, blood is returning, and then the electrical wires, like as you said, the electrical grid. This is where your phone line is being laid, or your cable going to your house to get the electrical impulse. But interesting, in the last I'd say 15 years, when the research is looking at, there was research out of Stanford and other universities looking at where does the actual needle go when we actually say put it in a cadaver, for example, and take slices and MRIs, looking at where these points actually stimulating. It's actually in between all of those three. It's actually in the place where it's stimulating the connective tissue. We now understand the connective tissue, which in Western medicine, we didn't care about connective tissue. In anatomy, we just dissected the body. We took away the saran wrap. That was all this kind of stuff that kind of puts all the organs together, kind of wraps the tissue around. But that's where the energy impulses, the electrical impulses now are being sent down. An interesting thing, there was some studies done when I was doing my neuro-acupuncture training and my medical acupuncture training through Stanford and UCLA, is that they did some studies where they actually injected with a fluoroscope, it's looking at with the fluoroscopies, like an X-ray.
Right.
And they put a radioactive tracer, it's like a dye, like a radioactive, like we use in imaging, like, for angiograms and stuff, or shoot a dye, we can see where it goes, right, flowing through the vessel. So they actually put the radioactive tracer in the acupuncture point. And interesting thing is it travels up a meridian, which is not a vein, artery, or nerve, which is fantastic, because you're like, how is this possible? But it's using Western medicine. And this is like we use fluoroscopy every day in a hospital. We use the radioactive tracer every day. So our body's a lot more complex than people will know. But to go further than this, it's almost like, before we used to think like there was only a line that could be given to send the electrical impulse, and now we have Wi-Fi.
Yes.
Right? Or now you're talking about earlier, like a transmitter, right? So there's different ways to send signals, right?
Yes.
And so as long as there's a receiving end and a delivering end, there's different. Our body's much more complex than just kind of what we've, classically we're taught to use.
So, okay. So what I took away from that is that when you are using or inserting the acupuncture needle, it's not really, it's not what people might think in terms of where it's being positioned. It's
Correct.
not going into or onto a nerve.
Nope.
It's going into a location that will help to facilitate the movement of an energy flow. So does that mean that the energy that's flowing in the body may get kind of locked up or may get blocked or something? What is?
Yes, and we do see that happen more with people that have more trauma or injury or scar tissue, or just same thing with normal physiology. There's lack of like the capillary blood flow. I mean, there's stagnation when people have trauma or impinging nerves or bulging discs or trauma to a muscle or tissue. Even the microcirculation to that area is hampered. Right. So then we know oxygen, nutrients, and even blood flow. The immune system is not working as well as we want it to. So that's something that we definitely are looking at another way of delivering a treatment that is going in a roundabout way. One of the things I wanted to show though is just when people look at acupuncture needles, just to kind of clarify, because you're right. When conventional medicine, we're using what they call hypodermic needles, and so most of us, me included, have this, when you say needles, we all kind of back up, even though I'm a doctor, it's kind of like, because, nobody likes that kind of idea, because, we're getting our blood drawn, we're getting our labs done.
Exactly.
Or you're getting treatments, you're getting IVs, for example. And so those hypodermic needles are serrated. There's like a sharp end and a tube that goes in where we can actually inject, or we can transmit IV fluids or medications or draw blood out. When we look at acupuncture needles, for example, I'll just show you here. I don't know if you can see this, but and the light's not good here, but they're actually independently packaged, and they're sterile. So each acupuncture needle is sterilized, and it comes in a little package. Okay, and then the practitioner will open up the package, take this out, and then I wish I had a better camera here, but you can see there's a blue handle on this one here.
Yep.
And there's actually a needle here, and this is what they call a guide tube. It's a plastic tube. Okay, everything is sterile. And what they do is they put the guide tube on the point, and then they click a button, and they just push the needle, and then it stays. Okay. Now the interesting thing is this acupuncture needle is so fine. Again, I wish I had a better camera angle. But
it looks like about the size of a hair.
It's thinner than the size of hair. And
really?
It's flexible. Okay, so you can see I can flex it. And when you look at the tip, if you were to use a strong camera, it actually is like a rocket ship. So it's not serrated. It doesn't tear the skin. It actually just separates the skin. And that's why when you do acupuncture, people don't bleed, because remember, it's not an artery.
Right.
I mean, there's can be little vessels here every once in a while. There could be a little bit of there's a little bit of a little spot here or there. But in general, it doesn't hurt. Like most people will I don't believe this is acupuncture, because they're used to I'm going to go get my labs drawn for my car. cardiologist, they don't like them. I got my arm bruised. People have these, bad connotations and experiences. And acupuncture is completely different, where we put the needles in. And more importantly, when we use neuro-acupuncture, that technique is actually going under the scalp, and we don't feel it. And,
how do you know where to place the needle?
That's the skill of the technique of the training. So, and I'll just give you an example, like this is the size of, and there's a handle. That's the size of the needle. So it goes underneath the scalp. And then this part of the needle stays outside the scalp. And we actually are going to be using our hands to actually twirl the needle. And when we twirl the needle in the scalp, and when you watch the documentary film, it'll kind of give you some examples of that. When you twirl the acupuncture needles, interesting thing is what the studies will show is that actually you're moving electrons from one side to the negative, like
that makes sense. That makes sense.
And it actually creates a little electrical stimulus. Now, there is also in general acupuncture, not neuro-acupuncture, but in general acupuncture, a lot of people do what they call electro-acupuncture, say for back pain or chronic back pain. They can put the needles in, and then they put these little little TENS units, these little people use it for pain control, and it stimulates like a little bit higher, stronger signal. We don't need to use the electricity though. When we do the scalp, we just use our hands.
So one of the things that I remember from the documentary, which fascinated me, is they were talking about how neuroacupuncture is able to treat what is referred to as neurodegenerative diseases.
Correct.
And other things like traumatic brain injury and whatever. I mean, there was a wonderful segment in the documentary about I think an Afghanistan vet who there was an IED explosion. He had massive concussion and brain injury, stuff like that. And people, you got to watch this documentary. It's absolutely fantastic. But can we talk a little bit about what we mean by neurodegenerative diseases and what they really are?
Yeah, so neurodegenerative diseases are just disorders or conditions of the brain. But what we're seeing is now there's a variety of aspects of neurodegenerative diseases due to inflammatory responses that come in our lifestyle, our diet, and our environment. So we now see dementia, which is on the rise. I mean, now any city you go, they're building memory care units, and
exactly.
So you go from assisted living, then eventually to a memory care unit. So dementia, we see Parkinson's disease, we see Alzheimer's disease, we see all these different kind of Huntington's disease, we see multiple sclerosis conditions. So those are the things that we see that are neurodegenerative. Even when people have stroke, for example, that becomes a neurodegenerative issue because there's actually damage from a bleed or from a injury to the brain. Otherwise, infections can cause that. People can get meningitis in the brain. But what now we're starting to see also is more like you'll see in the documentary is conditions that are in younger patients. So like autism, cerebral palsy. Those are kind of issues. Also, traumatic brain injury, which is common now. Most of unfortunately, our armed services men and women, they serve our country, but they're in harm's way a lot of times. They get, they're getting attacked. Or here you go every Sunday and go play football and get the same, on a certain level. People have traumatic brain injuries, and we now understand that this chronic inflammation, which we can always discuss in another time, but it causes neurodegenerative changes in the brain, which lead to certain things like tau, amyloid, and tangles. These are different type of protein plaques that cause that, like the electrical wires in the brain, the functioning neurons, to get disrupted, and therefore memory problems or speech problems or ability to move or daily activities are inhibited.
So does then the neuroacupuncture activity rehabilitate those damaged areas, or does it reroute around a damaged area, or maybe a little bit of both?
We think it's a little bit of both, and it's very interesting. The brain is a neuroplastic tissue. Okay, and what that means is that the brain is constantly regenerating. And where we went wrong with medicine in general in terms of neurology is we were trained like you were born with a certain amount of brain cells, and then you would lose some as you got older. You went to college, you played football, you drank some beers. That was the old joke, like, well, there was so many neurons kind of disappeared, right? But we now understand that that's not necessarily true. The brain is actually regenerating. Just like all your tissue has this kind of like life cycles, and there is things, natural environment, which we can talk about later in another interview, but there's things that we give integratively that can actually stimulate the growth, the nerve growth factors of the brain tissue, so that people that have a stroke or people that have these kind of these changes, we actually can change that brain function within a year on an MRI function, MRI scan. But what this the neuroacupuncture is doing, it is like a rehabilitation of the brain, and the benefit is that even when we put the needles on certain aspects where the neuroanatomy is markedly paralleling the part of the body, say lower extremity, say right lower leg or left upper arm, it could be a sensory problem like a pain, a neuropathy, or it could be someone has a stroke and their whole left or right side, they can't move. And so the interesting thing is, through this technique, sometimes within the first several sessions, sometimes several sessions later, is that most of these people, if we can keep the muscle mass strong, that's why physical therapy is important, we can actually regenerate their ability to move the function again. And that's the kind of the miracle of neuroacupuncture, where conventional medicine, we have nothing for these neurodegenerative diseases. So for example, when someone has a stroke, we can diagnose it very well. We can do a scan. We can tell you where it is. We can tell, where the part of the damage is. They get some physical therapy, maybe 12 sessions. The insurance runs out. We send them home. That's it. They're done. Right. And their whole quality of life, like they may not be able to brush their teeth or take a shower or move or transfer off the toilet or whatever it is. And the idea is that, so the nice thing about neuroacupuncture is for acupuncturists or doctors of oriental medicine, or even physicians who want to get trained, this is an amazing technique that, we're providing a service where there's no service currently available for these patients. So it's not competitive. In fact, a lot of the people who've gone through our training, there's 150 doctors now nationally and internationally are training, and we just have 20 more in 2 weeks now for another level 3 course that we're giving, is that we're training them, and then a lot of them will work with the neurologist. A lot of them will work with orthopedics, because remember, right now conventional medicine is triage, right? We kind of stabilize a bleed, we stabilize your stroke, we send you home, kind of thing. And this is a great way for people, if they say, hey, I want to kind of boost my practice, there's never a shortage of patients. I mean, just in primary care, or just in, you don't have to be a neurologist to do this kind of, everybody's going to see Parkinson's, MS, stroke, traumatic brain injuries, cerebral palsy, autism. And, we can improve the function of speech, cognition, swallowing, movement, strength, ability. I mean, these are things that we consider game changers. And when you see the documentary, and you can see, what we now will be posting, patients are posting their videos and stuff. It's quite amazing, because we're talking about something that's the least invasive, most cost-effective treatment. But again, it's just because it's in a different language, or it's coming from a different place, and it's not, a pharmaceutical drug that, people can stock in, or we can kind of, just roll it out and charge your insurance. It's actually a skill that is taught to the providers, but but provider skill is very specific. And that's why we have neuroacupuncture certifications, and they go through 3 levels of training to become a NAI certified practitioner.
Got it. I want to mention to the folks that are viewing this right now that if you have any questions about what we're talking about, send them in to info@referencepointtv.com. I'll get it to Dr. Pai. He can answer your questions, etc. So I want to dig slightly deeper into what you were just talking about there, Doc, because it seems that it's from what you're explaining, from what I've seen in the documentary, from what I've seen when I go on, YouTube and Facebook and see what people are saying who have experienced this. It is a technology that does, in fact, provide the kind of results that you're talking about.
Correct.
But it's not very well known. Okay.
Correct.
So why is that? What has to happen in order for people to become more cognizant of the possibilities?
I think social media needs to help us out. If I knew how to do TikTok, it'd probably be a popular thing. And all joking aside, the people who are providing this, we have world-class faculty at the Neuro-Acupuncture Institute. Dr. Jason Howe, Linda Howe, who are the foremost, teachers who pretty much brought this technique from China 40 years ago, this new contemporary technique. We train everybody every day, but we're more academians. We're treating patients. We're trying to publish. We're trying to, and with the Neuro-Acupuncture Institute organization, we as a nonprofit, we're always looking for donors that we can help with doing research and funding, and teaming up with the physical therapy hospital or neurological group, or
Hmm.
it's right now it's hard because a lot of people look at things as competition. We don't
Yeah,
look at it
right.
as competition. We look at collaboration because there's nothing for these patients.
Right.
It will take a celebrity, and we've treated many celebrities and we've treated many famous people, but it's like they also have to get out of their shell because a lot of people get treatment, believe it or not. I hate to say this, but they come in, they get treatment, but they don't want to tell their fans, they don't want to tell their on social media they got treatment because they're afraid of what people might think that they got acupuncture. So we're still at a stage where,
Oh, right.
it's
Yeah.
not really understood. And so they don't want to be like, I'm trying something that might be, they consider it alternative, but it's actually a traditional medicine that's been around for thousands of years.
And I think you've hit on something there, because there's this, um, when growing up, right? At least for me, it was all about what we know here in the Western world about the body, medicine, treatments, pharmacology, and all that kind of stuff. And anything that was not that, whether it's,
Right.
from some other tradition, was like, oh, well, that obviously can't be great because we are the coolest around here.
Yeah.
We
I mean,
really
we
know
thought we know
anything.
everything, and in fact,
Exactly.
it's coming about because with this documentary, A Return to Life, which was directed by Doug Dirth. He's a phenomenal director, and he did a really important documentary film prior to this called 9,000 Needles, which kind of put acupuncture on the map of understanding, like, wow, can we really help people with the stroke? And they were doing it in China, but it's like, no, we can do this here with even
Hmm.
less needles. It's like 6 or 5 or 3
Hmm.
sometimes. But when we look at this idea with the acupuncture um, in our lingo every day, just look how long it's taken yoga to come about, right?
Yeah, right.
And so it has to kind of cross over. And there's a lot of there's a lot of stigma because there's also some ethnic biases right now with Chinese and stuff like
Sure.
that. So there's always issues. But it wasn't really till, although acupuncture has been around for thousands of years, and it was all throughout Europe. You can look at European history, bringing it, influencing it all throughout
Hmm.
Asia. But it wasn't until really like 1972,
Mm.
I think 72, 71, when Nixon went to China.
Oh,
The
yeah, yeah.
journalist that went to follow him, he had appendicitis when he was in China. He had the surgery, but he had the surgery under acupuncture anesthesia. I mean, they were using acupuncture for the anesthesia, complete pain control. So I think it was New York Times. I can't remember his name, James Reston or something like that, a long time ago. But like that article, when he wrote it, because he came back from the surgery, he's like, they did this treatment called acupuncture anesthesia. It was like, like not just for like, oh, wellness. Okay, I have a headache, a back pain, anesthesia during an operation. And so when he wrote that, that kind of, we always kind of look at it as a pivotal moment because it takes like a piece of something, because he
Yeah,
was
right.
following Nixon, and everybody used to read newspapers at that time, and so it was like a big word, like what was this? What was acupuncture? It kind of really opened up. So I think by doing a documentary film and eventually by getting a celebrity or a politician, it's going to take that kind of status to kind of just bring it out as a common word that people can understand on social media or on the news, because there's still a bias. It's like, it's like
Sure.
they don't really understand, Chinese medicine, for example. And
So
so,
how are the Western medical professionals? How are they responding to this? When you talk to a neurologist or you talk to your typical physician here in the United States, are they um, open-minded enough about what it is that's going on to look at this and go, oh, cool, I can see how this could be an extension of my ability to help my patients improve?
on the whole, I would say there's more of a resistance right now, and it's just because the understanding of just anything out of conventional is just like they don't know about it, right?
Right.
And they think if something comes from a different language, if it's not in English, they just don't they don't follow it sometimes. But what I always tell people is when I have practitioners, for example, who are trained and they're kind of like, well, I'm trying to get some referrals from neurologists, and because they don't know what to do with their patients, so I always just tell them go introduce yourself, provide them information, and just have them send like 1 or 2 patients, and then have the patients give the feedback. And lo
Yeah.
and behold, it's very interesting because as their patients get better, the referrals will keep coming. The interesting
Sure.
thing is they just don't. There's still this hesitancy of explaining or saying something that they don't completely understand, right?
Right.
And that's why we're now with our neuroacupuncture training, we're training physicians. We're trying to get a lot of integrative medicine MDs or neurologists,
Mm.
pediatricians, right? How many kids have autism and cerebral palsy
Right.
and a neurologist, they're just seeing neurodegeneration patients every day, Parkinson's, MS, every day. Like that could be something that they could definitely use. But The other thing is that it's a technique and it's a skill that people have to
Mm-hmm.
learn. It's quite easy. It's very interesting. It's very specific. So like, there's protocols for every kind of condition. And that's why the level 1 through 3, you get to get more and more advanced. But
But
the
there is a
challenge is
very
that,
specific, training modality.
oh,
There's like
yes.
a,
Yes.
one gets certified in the ability to deliver this technology.
Yes,
Is that
because
correct?
we not only there's not only the didactic, there's hands-on training so that they have to actually do the skill. We actually bring in patients for them to train on as well, and then there's testing. So we have to test the knowledge of it and the skill base as well. So that's why there's levels. So it's kind of like you start off with
Right.
a karate kid, and eventually we want to get you to Bruce Lee, right? But there's a training
Gotcha.
to get there.
Yeah.
Everybody can somewhat have the technique, but the skill. And then when you see someone like Dr. Jason Howe or Linda Howe, who are they're just like amazing practitioners, you'll see things that you'll never see. Again, every time we do the training, to me, it's like tears will come from your eyes. It's just like
Yeah.
this wow, spectacular moment. Seeing someone who's not able to get out of a wheelchair or not move an arm or leg, stand up for 12, 15, 20 years. And sometimes within the first 1 or 2 sessions, be able to do that or a kid who's, nonverbal autistic for 7 years, just to put needles in the head and able to say, 1 through 10 and tell their parents their names or whatever. These are game changers. Now, we're not changing the physiology.
No, yeah,
We're
we're
not
not.
changing
Yeah.
physiology. Someone's still going to have MS, someone's still have Parkinson's, but to improve the quality of life of their day-to-day
Yeah.
functioning, for most family members and for me, that's what's needed. Like, I don't need to know the answer to everything, although I like the answer to everything. I don't
Sure.
need to know it. Like, as long as it's safe and it's effective and we can document that the patient's doing better, it's better than any of the drugs that we give that have terrible side effects, that have
Right.
black box warnings. And also, then we start, this drug for this drug, and then this side effect for this drug side effect. And, and yet they're
Yeah,
still
it's a
shaking.
cascading problem.
The tremor
Yeah.
is still there, or they're still using a walker. They're still using, so it's very interesting, but we do want to bridge the gap. Neuroacupuncture is a wonderful thing to bridge Western training, Western medicine with an Eastern practice. And
Right.
if and I always tell, if you're an integrative doc and you don't do this, go get training. If you're just someone say, I don't have time to do training, but I'm very open to this, find a neuroacupuncturist.
There's somebody close that you
on the
can
website,
collaborate with.
neuroacupunctureinstitute.org. You can go to the About, there's a global directory, find someone and then refer the patients, because remember, they're only going to do so much. So it's
Right.
like they're not going to compete against you. You still have to take care of all their other problems.
Exactly. It's like it's the analogy is in any kind of a business situation, you've got specialists in different areas. You got your accountant, you have your attorney, you have your your IT guy, and so they don't compete with each other. They provide
It's a team approach.
Team approaches. Okay, we have about a minute left in the show. I want to hear some last comments from you, but one of the things that is significant to me is, how do I communicate to someone who has a condition that could benefit from neuroacupuncture, who has almost given up because it's like, heck, I've been this way for years now and I'm not seeing any improvement. And so they're kind of in that depressed mode. What do you tell them?
So what I would do is I'd tell them to go to neuro-acupunctureinstitute.org and watch the documentary film Return to Life. That's the first place just to get them to see it, because you have to see it to believe it. Otherwise, it's just a foreign thing. Take a look at that, sign up, look at the directory, find a practitioner, and go try it. I mean, they have nothing to lose. Right? They only have anything to gain. And so I used to always tell people, because I have a lot of patients who are hesitant sometimes, like, I don't want to try this. I'm like, what do you have to lose? You've been sitting in a wheelchair for 12 years. What are you going to do?
It's not going to get any worse.
Not going to get any worse. There's no side effects.
Right.
There's no, it's not like you have to go to the drugstore to get it. It's not like, we're implanting, expensive electrodes in the brain for Parkinson's, Medtronic, technologies. And this is something that the average person can afford to get this treatment. It's safe, it's effective, it's least invasive. I mean, that's where healthcare should be focusing on. And then when you team up with an integrative practitioner like me, then we look at all the diet, lifestyle, other things that we can then have a synergy of improving those effects even more.
Fantastic. Dr. Pai, thank you so much for being here today. And I do want to follow up with you on more conversation about this interactive medicine thing and what you're doing there at San Giovanni, because that's a whole other area of interest and significance toward everybody maintaining a for themselves and their loved ones. So
yeah, so they can go to sanjevani.net, sanjevani.net, to learn more about our integrative practice, or you can read a book, An Inflammation Nation, and we can talk about inflammation on the follow-up.
cool. I'll put that, make sure people know about that as well in the show. So thank you so very much. And ladies and gentlemen, I hope you've learned a lot. I know I have. And we'll see you next time on Reference Point.
Thank you, everybody. Best of health.